Okay, so welcome everyone. I am delighted to present today's speaker, Dr. Rajan Dunne. Dr. Dunne is a board-certified psychiatrist and alumna of UC Berkeley, has an academic background rich in studies of mind-body connection, meditation, and beyond. Her medical training at Touro University, California, laid foundation for her study of integrative medicine, which was further honed through her residency at the University of Arizona and through her certification from the Andrew Weil Center for Integrative Medicine. She is a contributor to the psilocybin research at the University of Arizona and holds a certification in psychedelic assisted therapies and research from California Institute of Integral Studies. Dr. Dunne is multi-passionate, and today she wears many hats as faculty member at the University of Arizona Department of Psychiatry, a mentor at the California Institute of Integral Studies, board secretary for the nonprofit Women's Visionary Council, and the founder of the group integrative psychiatry practice Wildflower Psychiatry. And today she's going to be sharing with us on the topic of self-compassion as the foundation of integrative care. Welcome, Dr. Dunne.
Thank you. Thank you so much, Nosheen, for that introduction. I'm very happy to be here and share this with you all. So I wanted to talk about self-compassion as this foundational piece. I think in psychiatry we know about self-compassion. We know that it's important, but we sometimes, I think, see it as a nice to have or something you just kind of sprinkle on top. But I have found that I really see it as the foundation of everything else that we do. So if the self-compassion piece is there and is strong, it helps everything else to work more effectively and kind of flourish from that. But if it's not there, or if it's weak, or just not in a strong place, everything else kind of has a weak foundation to build upon. So I want to frame it as this foundational piece, because that's what I've seen has been true for me clinically. And I also wanted to talk about self-compassion today because, I'm talking to a group of psychiatrists, and we are in a difficult role sometimes. We're taking in a lot of information, a lot of emotions that are painful. We're doing a lot of difficult emotional labor. And self-compassion is something that is beneficial, kind of twofold. It's beneficial for our patients, but at the same time, it's beneficial for ourselves. And it gives us the resilience and the capacity to be there and continue in this work in a sustainable way, so that we're not burnt out, so that we're able to show up and be present for our patients. So that's why I want to talk about this with you all today. And this comes from the work of Kristin Neff. So Kristin Neff is a psychologist who studied self-compassion and kind of was the first person to formulate it in psychological terms. And she breaks it down into these three main elements of self-compassion that are kind of distinct elements, but they work together synergistically. And the first one is self-kindness rather than self-judgment. So this is about when we are experiencing a difficult emotion or a feeling of shame or a sense of inadequacy, how do we approach ourselves? Is it with kind of stuffing that away, or pretending it's not there, or a sense of self-criticism or kind of harsh self-punishment? Or is it with a sense of self-kindness, which is really meaning bringing warmth, bringing compassion, the same kind of compassion that we would naturally bring to a good friend who was going through a hard time. So that's the self-kindness piece. And then the second aspect is common humanity. So when we're suffering or when we're in a place of shame or other painful emotions, it's kind of a common pattern to think that we're alone in it. You know, there's something uniquely wrong with me. I'm uniquely affected by this. I should be kind of set apart from the rest of the world. But what self-compassion asks us to do is remember our common humanity. Remember that we belong to the rest of humanity, that suffering, pain, emotional pain is a part of life. It's part of the human experience. And we too, just like everyone else, experience that pain. And then the third element is mindfulness. So, mindfulness rather than over identification. And this is about being able to take a perspective, a kind of a witnessing perspective on our own experience of pain, where we can see it, observe it non judgmentally, see it for what it is. We're neither suppressing it nor are we immersing ourselves in it and acting from that place. We're able to take a step back and witness it with presence. So when we bring these three elements of self-compassion together, it prompts us to ask this question. And this is kind of the quintessential question of self-compassion. What do I need right now? It's a very simple question. It's a very powerful question too. So what we need right now can take kind of different forms depending on what's needed. So when we think about self-compassion, or usually most people, when they hear the term self-compassion, think about this tender side of it, the yin side, which is comforting, soothing, validating, kind of being with and accepting the experience of pain that you're dealing with. Kind of thinking about, you know, how would you react to a child who is crying? You would probably come to them and soothe them and be there for them, there with them, the kind of comforting presence. And there's also this other side of self-compassion, which is maybe not so obvious. That's the fierce side of it. And this is more the mama bear energy, right? It's like sometimes what's needed and what is a true expression of self-compassion is actually standing up for oneself, or making sure that your needs are met, or, you know, motivating yourself to achieve something because you care about yourself, not because you think you're inadequate and you need to fix yourself, but because you really care. And this is where, you know, you can connect with other people around causes and fighting injustice in various ways. So these two pieces together are kind of the yin and yang of self-compassion, the tender and the fierce side. And when you combine the three elements of self-compassion and you understand the two kind of aspects of self-compassion, you get this caring force. And the caring force is what is transformative and beneficial. So at this point, I think a lot of people might have a question about what, you know, what is that? Maybe it sounds a little bit selfish, or it sounds a little self-centered. You know, there's so many reasons to be compassionate towards other people, but isn't this a little bit of too much emphasis on oneself? So I want to talk about this for a moment. There's a distinction, an important distinction between self-compassion and self-esteem. So self-esteem is a positive evaluation of self-worth, usually in some kind of comparison to other people. Like I can judge myself as being good because I fall somewhere on this hierarchical spectrum and I'm above this other person. Whereas self-compassion is not a judgment on whether we judge ourselves positively, it's actually a way of relating to ourselves with kindness and acceptance. So it doesn't matter if you are, at the peak of success or you are at a rock bottom in your life, you can count on self-compassion to be there for you. Whereas self-esteem is much more variable, and it's kind of a fair weathered friend. It depends on how well you're doing, how well you judge yourself compared to others. So really, self-compassion gives us this message that we don't have to feel better than other people in order to feel good about ourselves. And I think that's really important to say. One of the things also between the two, self-compassion and self-esteem, is self-esteem, because it's much more variable, is not as reliable for emotional regulation. Whereas self-compassion, being always available no matter the circumstance, is a more stable source of emotional regulation. And self-esteem has been associated with narcissistic traits, whereas self-compassion is not. So there are many, many benefits of self-compassion, and I'll share kind of a list of them here. And this is in clinical populations. It is known to reduce symptoms of depression, generalized anxiety disorder, social anxiety disorder, and OCD. And in non-clinical populations, it's known to reduce measures of body shame, stress, imposter phenomenon, and fear of failure. And some of the things that it increases are sense of authenticity, autonomy, competence, self-efficacy, motivation, relatedness, personal responsibility for our own actions, personal initiative, health-related behaviors like going to the doctor or implementing a new program around sleep, exercise, or nutrition, as well as reducing smoking, adaptive coping styles, increased attachment security, increased interpersonal concern for others in most cases, increased relationship satisfaction, and increased life satisfaction. So, wow, right? Like, take that all in. This is something that has very broad benefits and is really transdiagnostic, right? We can apply self-compassion to most circumstances with significant benefit. And there are some risks of self-compassion to be aware of. And the main one is called backdraft, which is the distress that can come up when people give compassion to themselves or they receive compassion from others. And this can actually be quite painful and tender, especially for people who are new to this practice or who aren't used to receiving that level of compassion for their pain. And this can take the form of thoughts like, I'm unlovable, or emotions such as grief or shame, body aches or pains, and also behaviors like withdrawal or even aggression. And so the thing to do, this is like an intrinsic part of building a self-compassion skill set. And the thing to do with it is to be gentle with it and name it when it's happening, and support people through it with kind of a safety basis of the therapeutic relationship. So the clinical implications of self-compassion, I think, are really, really beautiful, right? Like if we take all of that information and we think, how does this work day to day in a clinical setting? Well, it shows up in how we talk about everything from lifestyle changes to therapeutic relationship to medications and beyond. So we can kind of go into some of these. Self-compassion actually motivates lifestyle changes. So we know from research that self-compassion is associated with increases in health-related behaviors. Implementing a new nutrition plan or a new exercise program. Uh, these are some of kind of the really common ways that I use self-compassion, is to get started with healthy behavior changes from a place of self-compassion rather than shame or kind of strict adherence to a plan that's coming from a place of self-control. If it's coming from a place of self-compassion, it's more effective because it's more sustainable and it's more enjoyable. So imagine somebody, you know, deciding that they're going to go on a run. That run is going to feel really different if it's coming from a place of self-compassion. I'm doing this because I care about myself, because I want to uh, take care of myself. I feel good after I do this. I know it's good for my health. Versus I uh, I need to control myself because I am concerned about overstepping a boundary that I had wanted to adhere to. And I think the same thing is true with medications. Kind of thinking about prescribing medications from a relational psychodynamic lens, the actual act of taking a medication, when it is imbued with this sense of self-compassion, I think carries a greater meaning, right? It's when we get to a point of somebody choosing to take medication with full agency because they want to demonstrate an act of care for themselves. And that's really powerful. I see better results when people get to that place with medications rather than kind of being resigned to it or still harboring a sense of shame about it, which I think is pretty common, especially in an integrative practice where sometimes there are negative associations or kind of a sense of having failed in some way to be taking medications, which is not true in my opinion. And I think it's powerful to get to this place of self acceptance and self compassion with medication prescribing. And then self compassion can also be woven into psychotherapy. And it can be woven into just about any style of psychotherapy, whether it's psychodynamic or CBT or something else, but it has these kind of elements of self-compassion. The first is having a compassionate presence just in ourselves. Are we practicing mindfulness and self-compassion? Are we able to relate to our own experience in sessions with compassion for ourselves? And then are we able to create a compassionate alliance with our patients? And this is how we engage with them, both verbally and non-verbally, um, coming from a place of radical acceptance, right? So that's like I'm radically accepting of what is with me, right? Whether that's suffering or pain or any other kind of difficult emotion, before jumping in to try to fix it or before taking any kind of action to alleviate it, just being with it and experiencing the natural kind of flow of kindness that emerges when you're with somebody in pain. And offering that compassion not from a sense of I'm giving compassion so that the pain will go away, but I'm giving compassion simply because this person is in pain. It's kind of a subtle distinction, but it's important. And then having resonance with the patient, right? An emotional attunement or resonance of being able to feel within ourselves in an embodied way a sense of what the patient is sharing of their own pain. And then being able to redirect or ask exploratory questions that build this inner resource of self compassion within the patient so that they can start to access it for themselves, even outside of sessions. And compassionate interventions are these kinds of practices that we can design together with patients to bring self compassion skills into their daily life outside of sessions. And so I think that this pairs well with a lot of different kinds of psychotherapy, but I think especially with IFS, internal family systems, and with acceptance and commitment therapy. These are kind of um, natural fits for working together. And another kind of natural fit, I think, is with psychedelic assisted therapies. So there is a kind of synergy between the insights and the wisdom that comes from psychedelic insights and the wisdom that comes from a mindful self-compassion practice. So there are currently studies that are looking at this, that are, considering self-compassion in all of the phases of a psychedelic session, preparation, the actual medicine session, and then integration. And, if you think about a psychedelic session, there are often feelings of shame, personal sense of inadequacy, painful feelings that come up. And self-compassion can be a very strong ally to have ahead of a session like that, and available during the session, and of course in the integration process afterwards. So it's being looked at as a potential mediator of the therapeutic effects of psychedelic assisted therapy. And lastly, this is really, really helpful for us as clinicians, right? It's been shown to increase work engagement, professional satisfaction, and it's been shown to reduce emotional and physical exhaustion, reduce sleep disturbance, and have lower levels of burnout. Uh, and so this is really powerful, right? It's something that we can do for ourselves. In doing it for ourselves, we're actually benefiting our patients. And as we are benefiting our patients with it, we're building our own skills in this area. It's a little bit different from other forms of self-care because you don't have to do anything on top of your list of to-dos, right? You don't have to fit in an extra class or do something in addition. It's something that you do during, right? It's like taking a moment to engage in a self-compassion skill during and in between appointments. It just kind of fits seamlessly into the course of a regular day. And so I encourage all of you to look into this some more and see what you think. These are some of the resources that I would recommend to start with. This first one is the website of Kristen Neff, and she has a lot of things on there, a couple of really good videos, but this is where I would recommend to start. It's a 5-minute guided audio meditation called the Self-Compassion Break. And it's so simple. It incorporates those 3 elements of self-compassion with a kind of embodied presence. And it's really easy to try. So I would recommend just trying that, maybe trying it a couple of times and seeing how that feels. And then this second website is the Center for Mindful Self-Compassion, which has a lot of training programs. So if you wanted to get further training, or to do kind of an 8-week program in it, that's what I would recommend. And then if you want some further reading recommendations, these are my favorites. I would start with the Self-Compassion book. This is kind of the first one, and it's a classic one. And then these are additional books that, if you want to get further into it, are really, really good. And I'm happy to share my references with anyone who would like. And I'm also happy to take questions, whether now or later by email.